Well, we are here today to have an in-depth discussion on mental health in Georgia. And we are pleased to be coming before the Georgia Commission on Women and appreciate very much their interest in this topic. It's certainly a focus at the legislature, and that's kind of what we're going to get into. And my name is Linda Hamrick, and I am the lobbyist for NAMI Georgia. And I've been a lobbyist at the Capitol not quite as long as Mary Margaret Oliver, one of our panelists, but close, not too far after her did I start lobbying. But I want to introduce our panel to you. And you heard just now that Mary Margaret Oliver is one of the panelists. Mary Margaret has been at the Capitol since 1987, Mary Margaret, I believe it is. She was elected to the Senate. Then took a little hiatus and came back in 2003 as a representative in the House and has been with us and very influential. And she was extremely important this last session when we passed the Georgia Mental Health Parity Act. Secondly, Kim Jones is with us as the other panelist. Kim is the executive director of NAMI, the National Alliance on Mental Illness for Georgia. And she's also the mother of a child with mental health issues. And she serves along with Mary Margaret on the Georgia Mental Health Reform and Innovation Commission, which is the genesis of the language that came into being as the Georgia Parity Act. So with that, let's just get right into the discussion. And I am going to ask Mary Margaret the first question. Mary Margaret, obviously this has become the year of mental health in Georgia. And as such, there were a plethora of bills, mental health bills that actually passed the legislature this year. And I know in my years down there, I've never seen such a focus on mental health, a welcome focus and a serious dive into mental health. A lot of bills passed on mental health, including the Georgia Mental Health Parity Act, which was the very comprehensive mental health bill that we're here to really dig into today. I think the main thing that this act did, the Mental Health Parity Act did, was to, for the first time in Georgia's history, it enforced parity with mental health as it is serving physical health, surgeries and regular physical health. So that was a main consideration for us, and we were able to do that. I'd like to know from you, Mary Margaret, what was the difference this year from past years in the legislature? And why do you think that there was such a strong push, starting with the Speaker of the House authoring the bill and putting his shoulder to the wheel on it? What do you think was the difference this year, and why did we tackle mental health to the degree we did this year?
I think it begins with and ends with Speaker David Ralston. But there's some history before and during the session that's relevant to his leadership that I think people would appreciate. I think every member of the General Assembly that has any awareness on any level of what's going on in his or her district knows that mental health services, the lack of mental health services, is at a crisis state in Georgia. A little over 2 years ago, Representative Kevin Tanner, then Representative Kevin Tanner, convinced the Speaker to appoint a behavioral health commission on reform and innovation. And Kevin Tanner has been significant engine behind this movement that came to very strong product of passage without any dissenting votes, House Bill 1013 in the 2022 session. Kevin Tanner, a year ago, about 6 months after the commission made significant recommendations, and in 2021, we did pass 2 bills of the recommendation of the Behavioral Health Commission, a telehealth bill and a second bill that expanded the authority of marriage and family counselors, but there was left on the table many other recommendations of the commission. And Kevin Tanner, a relationship with David Ralston, convinced David Ralston to allow this commission and the continued leadership of Kevin Tanner to go forward. Beginning in May 2021 and through today, May 2022, I have been working on this bill in a very significant way. Kevin Tanner's use of his work group came forward with a draft of a bill in the last 6 months of 2021. And with Kevin Tanner and other members of his work group, including both you, Linda, and Kim, we began visits with agency heads all across Georgia and with legislators to begin to vet a bill, a draft of which we had probably by the fall. So it was an extensive amount of history of advocacy in the commission, within the commission, and outward from the commission beginning in 2021 that built a strong set of folks, particularly again, David Ralston, who believed it was time to make a commitment. The 1013 bill came into a very public discussion in the last part, almost a public discussion in the last part of 2021 in December and January. And then it was introduced with David Ralston being the #1 signer, which is very important, in January 2022. And then we began the work of the 2022 session, which was a work every single day, as the three of us know.
Yes, how we know that. Kim, I want to ask you a question, but before I ask you, I'd like for the audience to kind of recognize that as NAMI's executive director and as a member of the Behavioral Health Commission, you served as the spokesperson for all the advocates and all the advocate organizations in the state of Georgia. And I learned very quickly that advocates felt as though they were not really listened to that often, or their issues were not taken to heart. There were things that were not done that needed to be done, and they just didn't feel like they were being listened to. And this year that changed. I would like you to tell us, from your perspective, what was it like as the head of NAMI to be in the middle of this effort and during this session as an advocate and as really the leader of the spokesperson for all the advocates at the Capitol? What was different for you, and how was that experience for you?
Sure. Well, thank you, Linda, and thank you to the Georgia Commission on Women for having this summit today. Every spotlight that we put on mental health helps raise awareness, and so I can always have to start with a big old thank you. Goodness, Linda, it was incredible. As a mother of a child with a mental health condition who really could understand at age 9 when his mental health condition showed up, and he was also having reading difficulties, I knew that the number of beds determined in our system for the jail and our prisons is based on those two things, mental health and reading capacity by 3rd grade. And so I put 2 and 2 together and realized real quickly that here in the state of Georgia, being 51st in access to mental health care, that my son was doomed to fail. And there were several other sons, daughters that were already going through the process. So for me to see what happened this session was just incredible. It was overwhelming to see the bipartisan, bicameral support on both the House and the Senate side, something that is historic to a bill that's over 70 pages long to see happen. And I was so honored to be in the trenches with you, Linda, and with Mary Margaret Oliver and several other of our advocates to carry this bill through and make sure that it happened. And as Mary Margaret mentioned, you know, we started early as advocates, and we can talk about this a little bit later about what we did different this year as advocates. But I think, speaking to what Mary Margaret said, there is no one, mental health touches 1 out of 4 of us, and that includes our legislators. And so part of the secret sauce for us was finding out what legislators were touched and getting their constituents in front of them and advocating and making these stories real and heartfelt. Because once you hear what's happening to people, I mean, anybody would want to change that.
Yes. So, Mary Margaret, now we get down into the heart, the bowels of this bill. And so the question goes to you as our deep diver, especially. What do you say? What do you think? What do you see this bill does? How is it going to make an important difference this year in the state of Georgia? And could you go over a few of the major provisions that you see to highlight for the ladies that are attending this meeting, so that they can understand a little bit about what the process was, what are the planks and the provisions, and so they can celebrate with us the passage of this bill?
1013 is a comprehensive bill that addresses many different aspects of our failing mental health system across Georgia. And it's the depth and the breadth of the bill that gives me a lot of hope that change is on the way. It's also true that the Commission on Behavioral Health, chaired by Kevin Tanner and supported by Speaker Ralston, we're meeting this month. We are beginning implementation strategies for the bill and beginning a long new set of tasks to make sure that our work is not put on a shelf somewhere. Section 1 of the bill creates the opportunity in the Insurance Commissioner of Georgia, following up on a federal act that was brought forward in the end of 2020 under the Trump administration, to make enforcement of parity, which has been a theoretical right of patients since it was passed by a federal Bush administration in 2008, a reality. There's specific tasks about obtaining data, about doing reviews of insurance policies, and the review particularly of a new consumer complaint process. All of those aspects are in the weeds of ways that enforcement of parity will become a reality. We also are going to enforce the federal law, which already exists, and I don't believe Georgia's in compliance with, that 85% of the premiums that go to managed care organizations, those treating foster care children and Medicaid children, that those premiums, 85% of them, be spent directly on services. That's called the medical loss ratio provision that we are enforcing in 1013. We know that workforce is a huge issue facing every professional, but is perhaps more crisis in rural Georgia and underserved areas of mental health professionals. We're creating a loan forgiveness program for psychiatrists and additional new mental health therapists in different categories of their licensure of $10 million, in excess of $10 million, to create incentives for mental health professionals to go to underserved areas. And for the first time, we are mandating that they take Medicaid. If they're going to take a loan forgiveness benefit and they're going to go to an underserved area, we have to make sure that they are collecting and participating in Medicaid. We find that we don't have sufficient data of health professionals in all the varieties of ways they serve the mentally ill population, and we're creating some new data resources in relation to that. We've had a good discussion and good progress on creating structure and funding for what we're calling co-responder programs. The law enforcement community was a very strong part of 1013 from the beginning. Law enforcement now is the first entity that responds on 911 calls that are in reality mental health crisis calls. And the co-responder program is where law enforcement partners with on actual 911 screening and 911 visits out in the community on mental health crisis. There's somewhere between 15 and 20 programs already operating in Georgia on this model of combining mental health professionals with law enforcement. And we are structuring that in a more positive way and providing funding for it, which includes a lot of attention to the transportation services. We have struggled with, and we are implementing in 1013, a new mechanism for mandatory outpatient treatment. The AOT program, outpatient treatment program, is going to be funded and set up in 5 different jurisdictions so that people coming out of crisis, out of jail or out of crisis psychiatric evaluations will have additional oversight and additional services. We're creating a new match program. We're really reviving a match program for children in residential serious mental health services to make sure that those agencies that have different ways of touching children, foster care children or Medicaid children, that we can provide them with a more seamless and actual placement opportunities, prevent the reality that many of the children that Georgia is responsible for in the foster care system are in hotels every night for a lack of services. We are expanding the jurisdiction of the Behavioral Health Commission in a variety of ways in order to assist in the implementation of the AOT program, assist in the implementation of the match program, assist in relation to a variety of discussions going on about difficult homeless populations and mental illness. Those are the main highlights of 1013. As you can see, I could go on, there's a lot more. I could go on, but as you can see, it's a very comprehensive bill with a lot of deadlines and a lot of future tasks that the commission will be following up on.
Yes, and with that, let me ask Kim, after hearing Mary Margaret go through, touch the top notes of all the different provisions that were dealt with in the bill. Tell us how the bill is going to affect the people that you serve, and what provisions of the bill do you think will have the biggest impact? And then to both of you, I'd like to ask both of you to kind of discuss for a minute what you think the importance of the makeup of the Behavioral Health Commission has meant. And by that, I mean, we had a lot of different types of people, a lot of different branches of the communities. And I think that had a big impact on the type of bill that came forth and the expert way in which the bill was crafted. So first, Kim, can you tell us a little bit about how it's going to impact the people you serve, and then speak to the makeup of the commission also?
Absolutely, Linda. I think, parity is the cornerstone of the bill. And what parity means is treating mental health at the same way that you treat physical health. And that is so important, not only just because of the act of having insurance companies do that, making sure that they are treating physical health and mental health equally, but it is the paradigm shift of how we think about mental health. And that is the real icing on the cake that I think a lot of people don't realize the shift that was in how we perceive and think about mental health, how it raises awareness, and that we no longer see it as somebody just not handling their behavior well. They may have a chemical imbalance in their brain, which is a physical part of your health. And so I think the parity portion overall, by far, for many, many reasons, was the cornerstone in helping us think differently about mental health, because we can't change a system unless we think differently about it and see it in a different light to make the right corrections to make it better. The other provisions that I think were really important were the law enforcement provisions that allowed a law officer, instead of arresting somebody who is experiencing a mental health problem and to be able to transport them, that a officer can now, if somebody is in a mental health crisis, they can reach out to a physician either by phone or telehealth and get somebody to help evaluate that person and take them to care, just like we do for physical health. We would never take somebody who's having a heart attack or diabetic insulin crisis to the hospital. To jail. But we do that all the time with mental health. Our jail systems have become our new institutions, for lack of a better word, and we call that decriminalizing mental health. So that's another really, really important factor to the bill. I think the workforce and demographics and looking at where people are so we can find where we are lacking in equity for our workforce. There are very few brown or Black providers in our areas, and we need to make sure that we know where those shortages are and where our gaps are so that we can fill those, and we need the data to do that. So requiring our licensed providers to provide that data is a first step in trying to figure out how to fix our workforce issue. And then, of course, what we did for our children, we couldn't have done enough. Our children are in crisis right now with mental health. That match program and will help people who are trying to get through the system, whether it's through foster care or if you have a child in crisis and you're on Medicaid. The match program will allow you to have access to several different agencies who can all sit down together and focus on your child and use their resources to get your child help. So that is incredibly important as well. And to your next question, I think all of the things I just talked about came about because of the diversity on the Behavioral Health Reform and Innovation Commission. I think the commission was put together in a way that it represented every aspect of our system. It represented advocates, it represented providers, psychiatrists, law enforcement, which unfortunately are the people right now who are having to interact with the people with mental health, and they should not be. That should be medical care, but unfortunately they are. So I think the diverse scope of people and experts that we had around the table for the Behavioral Health Reform Innovation Commission, from rural Georgia to Atlanta, helped make this what it needed to be to really move the needle for mental health here in Georgia.
Mary Margaret, would you speak to that also, working with the diverse group of people with different worldviews on all the different implications that mental health brings to Georgia? What was that like?
Kevin Tanner said in the beginning of the early meetings of the commission that he wanted the appointees by the lieutenant governor, the governor, and the House to be experts, people with expertise. And I think what was very unique about this set of discussions was that it was very expert driven, which is, I was the only politician in most of the rooms that I was in most of the times. And I think that gave it a healthier kind of discussion that was more reality based for people who are actually in the field. So the experts stayed with the project. That's the other thing too. They contributed, but people like Dr. Brenda Fitzgerald, she was chairman of a subcommittee on access with as we know, a exemplary, long professional, high level career, but she was always willing to come to the Capitol, always willing to participate. We had some very strong commission members. Gary McGibbity from the Department of Education, always available to come, always available to participate. We had a real commitment, a real workforce to this effort. And as we began to see, I'm talking as a commission member, as we all began to see the commitment that David Ralston was making and the success of the way in which the bill was proceeding, we had 10 hearings. And almost every one of those 10 hearings was standing room only. And standing room only 10 hearings means that people are paying attention. And each time we had a vote in the hearing, each time we were getting very, very strong votes. We also were we adopted somewhere between 50 and 100 amendments to the bill through those 10 hearings. That represented a huge amount of participation, a huge amount of engagement. If Todd Jones and I were what Speaker Ralston called his co-pilots, we were the two legislators that kind of managed this bill through these 10 hearings. And every time somebody had a conversation with either of us in public or in private, and their language was then put into the bill, it created buy-ins. It created buy-ins of people who knew that we were listening and knew that we were improving the product every single day. The product being a very strong legislative bill.
Yes, I think I was very impressed with the commitment of time that Dr. Fitzgerald, Gary McGibbity, and we had 3 judges, including soon to be Chief Justice of the Supreme Court, that came to the Capitol to work on this bill. what we saw, I think, firsthand was the passion, the interest, and the commitment of everybody to fix this problem. So
And one of the things that came out of all that energy was, if they didn't know it before, they knew it this process. Average member of the General Assembly, average House and Senator has been increasingly highlighting contacts from constituents who are telling them chapter and verse about the problems of obtaining service for their loved one. Every single member of the General Assembly's perspective on the need for crisis mental health services was increased, and that led to a vote that had no votes.
And to that point, I think it was something that I had never experienced as a lobbyist, but at I think it was the last hearing in the Senate, which was coming to the close of the session and winding down to the final vote for this bill. Kim actually brought to the committee, as she spoke to it, pictures of family members or friends or somebody in their districts and the legislative districts of the people that she was speaking in front of. And in that room, in the last few weeks or up until just a day or two before, each one of those legislators had a crisis that ended up usually with losing life in their district. It was very, very powerful and emotional. And those are the stories that were told that made everybody rally around that bill and give it that no vote. No, we had absolutely not one no vote, which is unheard of in a bill like this. So let's kind of pivot now to what's next. How do you see, or what do you think, Mary Margaret, let's go with you first, is the role of the Georgia Behavioral Reform and Innovation Committees? What is their role in keeping this momentum going? I like to say it almost with that powerful vote and that full support from the governor to the lieutenant governor to the speaker, and then every member of the Georgia General Assembly voting in favor of this bill. I kind of call it a rocket booster. We have a real strong boost going into the off session that we're in now and into next session. What do you see as the commission's role in keeping this momentum going, and what do you see the next steps are for the commission to consider taking? And then on Kim, after that, would you answer the same question, please?
Kevin Tanner and I've been talking since the session ended April 4th, and we have a meeting next week of leadership of the subcommittees and other team members to kind of chart out our first commission meeting post passage of 1013. And I believe that commission meeting has been set for June 9th, which will be available online for everybody on streaming, I'm sure, because our commission meetings have been streamed. We are outlining a very aggressive agenda. The bill, and one of the things that first of all we've prepared for each other to look at, what are all the timetables and deadlines that require X and Y and Z to happen? For instance, the bill includes a requirement that a prescription formulary be established. It had been set out in 3 different parts of the statute. Let's prepare a prescription formulary, meaning that consistent insurance coverage be required for certain psychiatric drugs. And in the bill in 1013, we place that obligation in one entity, the governor's Health Innovation Reform Commission, chaired by Grant Thomas. And in my conversations with Grant Thomas, I told him clearly, we're going to give this responsibility to you, Grant, and we have a deadline of January 1st, 2023. So we'll be checking back with you. That's just one example of things we put in the bill that we will be checking on. The new duties to expand the commission's authority to help more about the coordination of independent entities like the Match Committee and like the AOT. These will be assigned specific duties as defined as new duties under the bill. So there's a lot we're planning on doing. I've worked on this almost every day, but certainly every hour of every day during the session. And I'm really pleased to see that this work continues.
Kim?
Well, gosh, what are we going to do to keep the momentum going? Well, first of all, we are going around the state, myself and two other advocates, Mental Health America and Georgia Council on Substance Abuse, doing what we call thank you tours. Our legislators worked really hard for us for mental health, and we need to say thank you to keep them motivated and to keep them going. So that is definitely something that we are working on, making sure that we're going to our legislators' communities and educating them on the great work that their legislator did, and to let their constituents know what is in this bill as well. You know, there's a lot of great things that can be in this bill, but we got to let the people that use the services know what has changed so that they can help keep the implementation and keep accountability going. So those are the things. Also, Kevin's not yet, Chairman Tanner is not here to say this, so I don't want to take it from him, but he has coined this next year, or this next theme is the decade for mental health. So I think getting us all ready for this next session, really participating in these Behavioral Health Reform and Innovation Committee subcommittees and bringing our great ideas forward is what's going to keep the momentum coming and keep people engaged, and making sure that we do even better for mental health next year.
Any thoughts that either of you have for the Georgia Commission on Women? How can they be involved? How can they help us? Obviously, these are women that are influential in the state of Georgia. As a matter of fact, I'll just add right here that I was appointed to the freshman class in 1992. That seems like a long time ago. So I served on the commission, and I have to say that as the mother of a child that has suffered with serious depression, I am proud and honored that this step, when I come before my commission as a alumnus, I am proud that it's on this topic. So I know that many of us, many of the women on the commission know someone, have somebody that they love that suffers. What is it, Mary Margaret, that they can do to be involved or advocate, use their voice? Do you have any counsel advice for them?
Well, I agree that there's some very powerful, influential women on that commission. And I thank you for your long service. I think that the more we discuss these individual cases that we're seeing in the news every day, and we discuss the opportunities to improve a system that we're not happy with, we have this is a daily news story of somebody's conflict with somebody else, frequently involving law enforcement, results in death, where the issues of the conflict are rooted in some way or another in substance abuse or mental illness. That's a discussion we need to continue to have in very specific ways across Georgia.
Kim?
Yeah, well, this is where we pull out our advocate hats and we get really busy. You know, first of all, I would ask all the commission members to please thank their current legislators. Just a quick email. It doesn't have to be anything, a tweet, something on their social media page that just says, thank you for supporting mental health. Let them know that we are grateful and appreciative of that. You know, all legislators want to answer to their constituents, so making sure that they know that their constituents appreciate mental health. The other thing that I would ask personally is, you know, every year is sometimes we look at the work that we do at the Capitol as a battle. And so every year we go into battle and we need support. And what we do as NAMI is we will send out advocates alert, asking for our constituents to please, or asking the legislators' constituents to please contact their legislator to either vote yes or no or understand what's happening. And so that is really, really important, especially when we're down at the Capitol in the trenches and something isn't going the way that we need it to go, to have you call your legislator, forward on an email. And it can be as simple as sharing this presentation that we're doing right here and just saying, this was a great presentation. Please take the time to watch it. It can be a like on something your legislator talks about. It doesn't have to be something big. Those little things, sharing, posting, tweeting, that mental health is important to you makes all the difference in the world.
Kim, I'm going to interrupt you because I always make this point when I'm doing advocacy training. Most legislators hear from real voting constituents very seldomly. I think you'd be shocked. Percent of the communication to me is from lobbyists. I'm spending hours with you today. Both of you I worked with a lot and really enjoy the working relationship and depend on the working relationship of lobbyists like you, but you don't vote for me. I know, and I tell people all the time, if you spend 45 minutes a year communicating with your House member or your senator, he or she's going to know who you are. If you write them an email today that says, I am your constituent and I live on X street and vote at Y precinct, because half the people that tell me they're my constituent are not my constituent. They think they are, but they aren't. So if you start your note with, I'm your constituent, I live on such street and I vote at such precinct, and I want to thank you for the mental health bill, that's going to take you 15 minutes. Thank you. That takes 15 minutes. And then after the session, another 15 minutes, I'm your constituent, I live on so-and-so, I vote so-and-so, and I really appreciate your help on blah, blah. Or, I'm sorry you couldn't be with me on blah, blah, but I hope we'll work together in the future. That's 45 minutes a year. And he or she is going to know exactly who you are, because that kind of attentiveness to a specific issue by a real voter is very, very rare.
Absolutely, I agree. And we tell our members, you know, even if you just make a Zoom video like this and just say it was important to me and mail it, that whatever is comfortable for you, just do it. And I loved what you shared, Representative Oliver.
So let's just wrap it up with final closing thoughts, comments. Kim, you want to start?
Yeah, I just am excited to be here. And again, thank you to the commission for sharing the information on this bill and about mental health. Again, every opportunity we take to do that. I'd also just like to ask everybody to be intentional about their own mental health. We're not going to change the way Georgia does mental health until we also value it like we do physical health. A lot of us make time to go exercise every day. We'll take time to take care of your own mental health as well. And then finally, I would just like to thank Representative Oliver here for this, and Linda for all your great work. We couldn't have done it without you, and just the commission again for having us. So thank you very much.
Mary Margaret.
Thank you. I'm excited about the work that's before us this year. I think that this is an election year where all the nation is looking at Georgia one more time, and all of us have an opportunity to participate in this important election year. And working on real issues that have real meaning to actual people is really the joy of politics. So I'm excited and I look forward to new successes.
And as a former commissioner on the Georgia Commission on Women, let me just assure you that the two ladies that I've been honored to work with over the last year were the engine. These two ladies literally worked day and night. We hardly slept. We became closer than sisters, and we would go into any trench together. I can tell you that it was nonpartisan. It just doesn't matter when you're talking about those you love with mental health and seeing the suffering that goes on, all the walls come down. So let me just say to the commission, it's a joy to be here. It's a good joy to bring this message of hope, because it is a message of hope. I think the speaker aptly said that one of the reasons that he wanted to bring, or was committed to bringing this bill, committed to putting his full weight behind it, was because he was heartsick at having to look in the eyes of mothers and tell them he did not know where they could go to get help for mental illness. And with that, I can tell you that these two ladies were the go-to people for the speaker. He listened to them, he counted on them. The women were very powerful in this movement, and it's an honor to be working with the two of them. With that,
Thank you.
well, we love you both, and I look forward to the hard work ahead, and hopefully revisiting the Commission on Women to letting them know next year how the steps we've taken towards getting the system fixed. With that, we want to close and thank you for your attention on this issue, and many blessings to all of you out there, and thank you very much.
Bye.